So this sounds really interesting how telemedicine is ease of use for patients. Patient can pick and choose which doctor they're going to go to and where the doctor is. Doesn't matter, how far the doctor is. How does this technology can be implemented by either community hospitals or physician practices? How easy it is or how difficult it is for them?
Right. Right now, it's not easy, and it takes a lot of leadership. If you think about medicine today, many things are new, but much is the same that we've practiced medicine for a long time. And it takes strong leadership to take a practice or a hospital or a health system and get it focused on operating in a new way. In our case, it was the leadership of our CEO who said, we need to focus on the future. We put together a team focused on innovation, and we have people dedicated to this. So none of this would have happened on its own. But it also takes a fair bit of trial and error. So I described to you the way that we have this service where patients walk into our ED and get cared for by video within 30 minutes. We've done that more than 10,000 times in the past 14 months. Well, the first time we did it was a small trial of about 50 patients, and we learned from it. We made sure that the patients got as good or better care than they would have gotten otherwise, but those 50 patients worked. So we did another 50, and then 100, and then we just kept doing it. And it's that willingness to focus on the patient, make sure they get good care, but trial and error and work in new ways that really defines the ability to work in new ways.
Who do you think is really leading the charge on digital transformation in healthcare? Is it a big corporation? Is it smaller corporations?
There are a lot of small companies that are interested in getting into this space. And there are any number of places you can go online to get care, but they have an end about them. You can get an urgent care visit and it's via video, but that's the end of it. The challenge is some of what we're doing, providing that care, but then being the entree to an entire universe of specialists and follow-on care and surgery and tying that all together. So there's a lot of innovation that's happening in this space, but it's really the providers, whether it's individual physician practices or hospitals or health systems, that need to put it into practice.